Morning. So my name's Tim Hutchinson. I am the Broomfield County Veteran Service Officer. I work for the City and County of Broomfield. I do not work for the VA, although I work alongside people from the VA and often, with their systems and their platforms in order to do benefits, claims, health care enrollment, those types of things. And so today what we're going to talk about is the PACT Act. I'm sure everybody heard of the PACT Act, and the slides are going to have a lot of information on them. That's just to keep me on track. It's the golden rule that I break every time. There's a lot of information on the slides, but these slides are just to make sure I'm getting you the information. So the PACT Act is perhaps largest healthcare and benefit expansion in VA history. Full name of the law is Sergeant First Class Heath Robinson, honoring our promise to address Comprehensive Toxics Act. So the PACT Act. It will bring about these following changes: expands and extends eligibility for VA healthcare for veterans with toxic exposures and veterans of the Vietnam, Gulf War and post 9/11 eras. It adds more than 20 new presumptive conditions for burn pits and other toxic exposures, and adds more presumptive exposure locations for Agent Orange and radiation. It requires the VA to provide a toxic exposure screening to every veteran enrolled in VA healthcare. So that's going to be a new thing where everyone's going to get a toxic screening exposure. Helps the screening a lot of times is known as they have a Gulf War registry, an Agent Orange registry. They call it a registry, but those are important because it helps them improve research, staff education, and treatment related to toxic exposures. If you're a veteran or survivor, you can file claims now to apply for PACT Act related benefits. So they were going to phase it in, but the Secretary of Veterans Affairs said, no, we're just going to go ahead and we're going to implement at least the benefit portion now. I know that they're also going to phase in some of the healthcare portion, but it's pretty much, since they signed it into law August 10th, it is on the books. So presumptive. So presumptive is a word that a lot of people ask what that means. So a presumptive is the VA will presume the contention is related to your military service. So if you served in a certain area or had a certain type of exposure, and the VA considers that condition related to those exposures that you experienced, then the VA will consider that as a presumptive. So the VA needs a current diagnosis and proof of the service location. The VA will look for the service location in the records. So really a current diagnosis is what you have to provide the VA. And the VA will provide a compensation and pension exam, also known as a C&P exam, and they will determine the severity based on their scale of rating criteria. And then they'll make a decision as to service connection. So a presumptive, normally you need three things for any claim: and diagnose current disability, an event or injury in service, and a medical connection between those things. With a presumptive, the medical connection is already taken care of, so you just have to have the diagnosis, right, of the condition, and then serve in the area that they feel is related to that condition. So Vietnam, how does the PACT Act change for Vietnam veterans? So Agent Orange, we know, was the tactical herbicide the U.S. military used to clear leaves and vegetation. They used it obviously in Vietnam extensively. They used it in other areas. They used it around bases in Thailand. But in order to get a presumption in Thailand, they were requiring you to prove you were around that base perimeter. In other words, if you were a security personnel, some type of job that puts you at or near that base perimeter ongoing, then they would grant it. But what they did is they changed that. So the current presumptives for Agent Orange. So they've added to it obviously over the years because there's evidence that supported that these conditions are related to the dioxin exposure in Agent Orange. So bladder cancer, hypothyroidism, Parkinsonism, which is a Parkinson's-like disease. There's several of them. Progressive supranuclear palsy is one of them, a PSP, that is now considered. Parkinson's disease itself, prostate cancer, ischemic heart disease, which is coronary artery disease, type 2 diabetes, B-cell leukemia, Hodgkin's disease, multiple myeloma, non-Hodgkin's lymphoma, respiratory cancers, some soft tissue sarcomas, amyloidosis, and chloracne, and peripheral neuropathy, early onset, and porphyria cutanea tarda, I guess is how you pronounce that one. But these last three, they have to be diagnosed within 1 year of exposure to Agent Orange. However, if you have diabetes and you have neuropathy, you could still claim it as secondary. But the last three, that you have to have it had to have been manifest to a compensable degree within 1 year of the veterans leaving the area that they were presumably exposed. So the PACT Act also added hypertension and that MGUS. And people ask me what MGUS is, and I'm not really sure, but I'm sure if they diagnose you with it, that it would be something that you're aware of, and it is now a presumptive for Agent Orange exposure. So I don't think it's that common, but if you meet the criteria, you could definitely file for that as related to Agent Orange. So the criteria up until the PACT Act was the boots on the ground in Vietnam between January 9th, 62 and May 7th, 75. The Korean DMZ, although I still see people that get denied for that one. So you have to fight it sometimes because you have to have been actually in the DMZ. So they ask for an explanation, you give them the explanation, and they come back and a lot of times they deny it. So you need to fight those. U.S. military vessels on the inland waterways, so the brown water. And then the blue water, which is within 12 nautical miles of Vietnam. That was passed a couple years back. Perimeter, so it used to be on perimeter duty in a military installation in Thailand, and it talks about the different bases, and assigned to a unit location where C-123 aircraft had traces of Agent Orange. There's certain locations where they list transporting, testing, or storing of Agent Orange if you were involved in that, and certain reserved time frames at Lockbourne, Rickenbacker, Westover, and Pittsburgh. So they added the new locations at it. An important part is you also qualify for health care, even if you don't have a disability, so that they can, at least provide health care and monitor and give you the exposure examination as well. So any U.S. or Royal Thai Air Base in Thailand from 62 to 76, regardless of perimeter duty, that's been taken off the table. If you served on the base, you get the presumptives. Laos from December 1st, 65 to September 30th, 69. Places in Cambodia, Guam or American Samoa and territorial waters from 62 to 80, and Johnson Atoll from 72 to 77. And then these will give you health care access if you served at any of these locations as well. So they've added new conditions, they've added new locations, they are phasing in health care for the veterans that served at these locations because of the risk of exposure. So the Gulf War. So they have some all the presumptives for the Gulf War, Southwest Asia service, the gastrointestinal disorders, chronic fatigue syndrome, which has to be a diagnosis of chronic fatigue syndrome. The VA just will, if you claim fatigue, the VA will look at it and say, well, it's not chronic fatigue syndrome. Fibromyalgia, asthma, sinusitis, rhinitis, and undiagnosed illnesses, and then certain diseases such as West Nile and malaria. Oh, I don't know why that's on there. It wasn't Agent Orange exposure, but that's my mistake. So in Afghanistan, they have a bunch of different diseases that are related to service in Afghanistan. So I won't go through all of them, but these are the ones that have been most common. And you know, the Mycobacterium tuberculosis and the visceral leishmaniasis are probably two of the top ones, but there are others that may not be presumptive, but they may have gotten. Locations added by the PACT Act for the toxic exposures. So these are all the locations that have been added to the PACT Act. So one of the things is they added a lot of places for toxic burn pit exposure. A lot of people are coming back with breathing issues, difficulty breathing, with no diagnosis, but yet they'd still give them an inhaler, albuterol, like they had asthma, but there was no evidence of asthma. So there's a lot of respiratory ailments that are due to burn pits and toxic exposures from the Gulf War on. So these presumptives were added by the PACT Act for Gulf War. So brain cancer was a big one. A lot of veterans had passed away with brain cancer, the glioblastoma, different head cancers, kidney cancers, lymphatic, gastrointestinal, and then lymphoma, melanoma, neck cancer, pancreatic cancer, reproductive cancer, and respiratory cancers. So there's a lot of cancers that are now presumptive for these exposures. And then illnesses that are added by the PACT Act, asthma. So even if it's diagnosed after service, you're having respiratory issues, and it's eventually diagnosed as asthma. Bronchitis, chronic obstructive pulmonary disease, or COPD, and this is all for the toxic exposures for Gulf War and on. That doesn't mean that that you can't file for a claim for these conditions if you served, say, in Vietnam, but then they're not presumptive. So then the burden of proof, you have to show them why, or explain why, what your exposures were, and why you might have had one of these, these diseases related to exposures prior to this, because the only presumptives are for the veterans that served Gulf War on. So rhinitis, chronic sinusitis, bronchiolitis, emphysema, interstitial lung disease, and pleuritis. So there's a lot of different conditions and a lot of the veterans got on the Gulf War registry, and they were really finding these clusters of different diseases that required further exploration, right? So they did studies, and now they've added all these based on their their studies, and the evidence is pointing to that it was related to the exposures. So VA benefits. So VA benefits phone number. This is a good phone number to have if you have any questions regarding VA benefits whatsoever. And then, of course, health care. Health care, that's the biggie right there. So if you've never been, I always say to veterans, if you've never enrolled in VA health care or tried to enroll in it, I would try to get enrolled in it and be in VA health care. Circumstances change, and having VA health care is a benefit. And if they do deny you for whatever reason, and say, because there's only a certain amount of ways in it, but they just expanded some of the ways into VA healthcare. So even if you previously applied, I would say reapply. Yeah.
Tim, if you're already kind of covered by TRICARE, TRICARE for Life,
right?
Are you saying still go ahead and apply for this as well?
I would, because circumstances change. So say you have a health setback, and you're going to need some in-home type care. You may be able to get that through the VA, where you may not be able to get it through another type of health care. So if you're in VA health care, if you're being seen for something that's not service connected, the VA is mandated by Congress to charge any insurance you have regardless. So they're still going to charge insurance you have, unless it's Medicare. I don't believe they charge Medicare unless it's a supplemental policy. Then I believe they will charge the supplemental policies that you have. But there's benefits to being in VA healthcare, because it doesn't affect your healthcare coverage, because VA healthcare is a healthcare system, really, not an insurance of any type. So once you're enrolled in that whole system, you can utilize that system for different needs. And all you have to do is to really stay active in VA healthcare is go once every 2 years. Be seen at a VA facility once every 2 years. And if they are taking care of your prescriptions, then you got to go once per year just to validate that you still have the same prescriptions. And so that's really the only criteria to stay active in VA healthcare. The other good thing about VA healthcare is they have a network of urgent cares. And in Broomfield, we have one on, I believe it's over on Nickel Street, right next to the bowling alley over there. I believe that is still part of the urgent care network.
I think the hospital on the other side of 36 is an emergency center for veterans.
It may be, yeah. Yeah.
University of Colorado Medical, that University of Colorado.
Across the highway right there?
Yep.
I got a question also.
Sure.
So, 10 years ago, I applied to the VA when I was told, well, your income doesn't qualify you for VA.
Correct.
And I said, well, I'd like to be on it anyway. I can't remember whether they said okay or whatever.
Well, they usually put you in category 8, to one of the last categories. So how that works is they're saying, you're not eligible. But if you go to the VA with a DD-214 to the emergency room, they're going to see you, But yes, so there's only certain ways into the VA healthcare system. One of the toxic exposures that we mentioned, having a service-connected disability, and meeting the financial criteria, which the financial criteria is based on household income, which I believe in this area is around 62,000, around there somewhere. So if your household income is below 62,000, then you can apply for it based on the income. But certain exposures, right? Certain exposures will get you in the VA healthcare system. So that expansion, if you qualify for one of those things, but I'm in a weird area there from 84 to 88, right? So that area there is after Vietnam, before the Gulf War. So there's certain benefits that I'm not, not eligible to have.
Well, for instance, TRICARE
Mm-hmm.
is hooked to Medicare. So
Mm-hmm.
anything that Medicare covers, TRICARE will cover.
Mm-hmm.
TRICARE for life, if you're retired.
Mm-hmm.
But Medicare doesn't cover, and therefore TRICARE for life doesn't cover, anything that has to do with feet,
Mm-hmm.
and anything that has to do with ears. So your hearing aids and stuff like that. But the VA does cover that. And that's why I signed up years ago trying to get on the VA.
But has your income changed from 10 years ago? Did you retire?
No, I'm retired, but I'm still
You make
above
too
it.
much money, Joe.
So the main thing to remember too is, do you have any disabilities that you didn't claim? Because there could be something that you could claim as a disability to get in the VA healthcare system, which, I would say, being on an aircraft carrier myself, it's a pretty noisy environment.
That's true.
And so, I've had tinnitus, since then, at least. But, so tinnitus and hearing loss can be filed for.
Biggie,
Yeah.
That was with me too.
Yeah, if it's something that you've never filed for, I would think about filing for it. The other thing too is for pilots, neck issues, back issues. There's a lot of different things that that can be looked at that normally that we're not really always thinking maybe related to service, right? So there are some things there that you have to really look at and say, okay, what did I do and what's bothering me? What are the issues that I think are related to service? And then file for it, because if you don't make it based on income, then then there's only so many other ways into VA healthcare.
If you haven't had a hearing test, for 10 years or so, it's not the beep beep thing it used to be. You're listening to conversations, and I had one done at the VA, and so I qualified for the hearing aids, which they paid for.
Yeah.
But I'd absolutely look that over.
Yeah.
Well, they have.
I was a destroyer, and I was in a 5-inch 38 gun crew, shooting the hell out of stuff, and they said, oh, you don't have hearing loss. But the second time, when I went back, they said, 30, 40 years later,
Right.
oh yeah, you have it was kind of funny, you have a high-pitched voice. You can't hear the high-pitched voice like a woman. And I said, would you write that down so I can take it to why?
Exactly.
Right.
But they ended up paying for it, but they didn't give me any disability on that.
It covered you from selective hearing to actual hearing loss for the wife. So
Real procedure.
yeah. So I would say it's something to explore and look at. And think about when all the criteria come out for all the different healthcare eligible, right? Places and conditions and all that, then it could be something that maybe might be eligible for getting in the healthcare system.
What was the phone number you had for the VA benefits?
So the VA benefits is the 1-800-827-1000.
Thank you.
So that's a number where you can call if you're even thinking about filing a claim. You can call them and say that you want to file an intent to file a claim for compensation, for disability compensation, and the clock will start. They'll send you the paperwork, and you'll have 365 days to file that claim. If you don't, it just drops off. No harm, no foul.
So when would they want to come to you then?
Anytime they decide they want to file a claim. So if they're just thinking about it, they could do that and protect the effective date. And then they can gather up or give me a call, and then I can say, okay, these are the things we need. Then we can sit down and, or we could sit down and I could explain how the whole process works. I like to explain how the whole process works so that everybody has an understanding of why the VA does what they do. Because sometimes it doesn't make sense when they're trying to file for a claim, why the VA is making them jump through these different hoops. And even if they already bring evidence that they have a condition, and then the VA still makes them go do an examination.
That second phone number in the next slide.
Mm-hmm.
I can't remember whether they kept me registered or not. If I call that number,
You could call them and,
look to see if at least I'm registered, even though I was not.
yeah, you can call and ask them. Yep. They should be able to tell you if you're in a category, what category you're in. If they gave you, it's probably 8, which means you're over income.
Right. And they use the Social Security number?
Yeah, they'll ask you for Social Security number, dates of service, different things that you got to provide just so that they can, verify who you are.
Okay.
Yep.
If you end up in category A and you pay your, what was it called, your portion of the payment,
Mm-hmm.
and you sign a piece of paper that says it will no longer monitor your current income, you can continue through on VA. And even if you miss the 2-year thing for some reason, like I did, they'll put you back in.
Yeah, there's a.
It's a lot more. It's not as scary as it sounds.
No. So there's even if you missed that 2 years, you just would call them up and there's the 1010 Easy is the form that gets you in. Then there's a 1010, I think it's I forget what the form number is, but it's to re-enroll. It's a re-enrollment form. So you had been enrolled in the past, you dropped off, and now you can re-enroll.
My point is, once you get in there, they're not as bad. Once you get past all those silly things you have to go through to get those
Right.
benefits, even if you are denied a couple of steps on the way. Again, if you agree to, I wish I could think of the word, pay your copay. You agree to pay the copay, and they will send you a statement of some sort that they're not going to continually harass you over your yearly.
They don't anymore because they have matching with the IRS. So they know what your income is. Because the reason why they want income if you're enrolled due to an exposure is they want to know, so Agent Orange, right? So boots on the ground in Vietnam or in Thailand or in the Blue Water Navy, whatever the exposure was. You file for it. You don't have any of the issues associated with it, but you file for VA health care. Well, because of that, they'll allow you in, but they still want your income information because they need to know how much copay or coinsurance to charge you. Right. So they're going to want that. But what they do is they send a letter out now saying we're not going to send you and have you verify it every year because they're going to do IRS matching now. So they're still going to check your income just to verify that your copay should be where it's at, because if you meet a certain threshold, they're not going to charge you any copays or coinsurances.
What about Express Scripts pharmacy through TRICARE for Life? Is that, could I pay, whenever you do it, you know what Express Scripts is?
I imagine it's the same thing as pretty much having it delivered to your house.
It is. It's mail order
Right.
pharmacy that is connected to TRICARE
Sure.
for Life. Okay, I just wondered if the VA had anything to do with that.
They don't have anything to do with that. If you're in VA healthcare and they say, okay, yes, you qualify for prescription benefit, then they'll ship them you a 90-day supply, and you just, you could either go online or over the phone or find different ways to reorder those prescriptions. Yep.
My wife worked for the benefit center for about 5 years before she retired. And as not old, but more mature veterans, I think what we ought to do is talk about how we could get together and make a concentrated effort to educate these younger veterans coming out. Because what happens is, when we were all young and dumb, you get out, hell with it, I'm done, and you didn't go to you go to the VA and get your out of service physical, but after that you didn't do anything. But there's so many kids that are getting out that have problems that tell these kids that they need to go, because you said it earlier, you don't know what's going to happen in the future.
Correct.
You got to get into the system.
Yeah, and I do see a lot of younger vets. So a lot of them are filing claims as soon as they get out. So a lot of them are, some of them aren't, and some of them, are having difficulty. But there's a lot of services out there. There's a lot of help out there, for them if they, if they are looking for it. Sometimes they're just not looking for it,
The typical thing is, there's a lot more people out there that need benefits more than I do.
Yeah, well,
So you don't know about the future.
but people say that all the time, and I tell them the benefits are here for you. You're not taking benefits away from anybody by filing for them. Anybody that has them coming, that's what they're there for. Yeah.
What about asbestos? Have you ever come back and look at that again? Asbestos is every place in the Navy when I was there.
Yeah.
Oh, yeah. I mean, if you go to the restroom, there's a screen and it's got asbestos in it because
Yeah.
that's what they made it out of.
So asbestos, those are tougher claims, but really, if someone has a condition, it has to be associated with asbestos, right? And I tell people this, whenever I file a claim with someone, I tell them all the time, if it comes back denied, as soon as whatever your claim, if it comes back approved, denied, call me right away. Because I don't get notification. The VA says we send you a copy. I never get a notification. It goes to the Colorado Division of Veterans Affairs if they get it at all. So if they don't call me and tell me that they've been denied, then I don't know. I mean, I just don't know if they're denied or what happens with that claim, right? So what happens, people get frustrated when they get denied, and then they don't call, they don't want to deal with anything, but that doesn't mean you still have due process, right? So there are ways to get those service connected. It's a little tougher, right? So there's certain things that, and the number one and number two for asbestos is Navy Coast Guard, right? For asbestos related diseases. Obviously, right? Every ship, like you said, has it on every ship. The lagging around the pipes. It's just, if you worked around, machinery that had brake pads in them and you had to change those brake pads, there's asbestos in there. There's asbestos throughout the whole ship. So if someone has one of the diseases associated with it, you can file for that claim and think that that's going to be enough just where you were, and that you say, I was on this ship and it was in the shipyard, and they think that's enough. Sometimes that's not enough. There's specific statements that you need to send with the claim that explain a lot of this stuff. And actually, there is a gentleman that was at our last conference that if we have issues with asbestos claims, he will assist with those. And he doesn't care. He'll look at the information, talk with the veteran, he'll create a statement based on their database of doing this for, a while, so they can probably tell you. I mean, I had a conversation with him and he's telling me I should go get a CAT scan. Because he said the really only way you could tell is a CT scan of the chest. And I told him everything I did, and he goes, you should get one, So that's something that I've been, but I'm thinking about. But so it's not that the VA relooks at asbestos claims, it's the evidence that you submit with the claim is going to be important. You can't just say, I was here, and here, in this time in my job. I mean, I've had success with some of them because they were boiler techs. And they put statements in there that they used to have to go inside the boilers and scrub them with nothing. And so you go inside the boilers and went to clean them out, and they scrub them with scrub brushes and all this stuff. And then, years later, they get, mesothelioma. So you can file for those, because there's different things, phases of lung issues before it gets to that, right? So, so to answer your question, if someone has a disease, pulmonary disease of some sort, and they believe that it's related, we could sit down, and it's going to take a lot more development. So we want to file an intent to file right away, and then work on the development of that claim to get it to a point where it's ready to submit, so that there's enough evidence there to show that they what the condition they have now is related to their, because, the time frame it takes, anywhere from, 15 to 40 years, or more before this shows up, manifests. So they're tougher claims, but they're definitely winnable. So, but what happens, like I said, is people get denied something, they get frustrated, and then, well, the process is the process. The process isn't going to change. So if you're frustrated because it comes back denied the first time, sometimes you got to fight these things.
Does your office cover just Broomfield, or are you covering the area, or just Broomfield, city council?
So I work with city and county of Broomfield because Adams County, Jefferson County, Boulder County, they all have VSOs. However, if someone's close to the border and they have transportation issues and what have you, I always refer them to their county first. They may have had a bad experience with that VSO, and they say they want to work with me. That's fine. But if someone's in Arapahoe County, it's not going to work, right? So, but I work with pretty much whoever. Yep.
So I was at the Miramar Air Show here not too long ago. One of the booths they had there was an organization that is trying to, they've supposedly got proof of Army, Navy, Air Force aviators, high incidence of prostate cancer and some other cancers, mostly from high altitude flying. What do you know? Have you heard anything about this?
So I have not, but with any claim that is not considered presumptive, it's all about the evidence that you present. The other thing too is whenever you file a VA claim, first thing they're going to do, you're going to give evidence that it's possibly related to service, and if the VA says, okay, there's enough evidence here to grant an examination, they'll grant a compensation and pension exam, a C&P exam. And those exams do three things. They verify you have the disability you're claiming. It assigns a percentage based on the criteria for that condition. And that doctor makes an opinion. Is this condition, at least as likely as not, related to service, and why? So that when that doctor does that, okay, so you file the claim, they come back and they deny it, and the doctor says why. Well, it would be in your best interest, anyone that was filing a claim for that, to kind of do some research and find some studies that say, hey, this is the incident rate for these types of jobs, right? These types of cancers, and show that there's a correlation there, and then take that to a doctor.
Would you, within the VA, your system, the service officers have a connection like you were talking about the other guy that, the one that was an expert on the other thing that you can contact for something like that to get that referencing?
No, I don't have any. The best thing to do is go to your doctor who's treating you and give them the evidence and say, hey, look, these are the things that they say could cause this, and making sure that doctor understands that the criteria is only at least as likely as not, or 50-50. If the doctor understands that we're not looking for medical certainty here, we're only looking for a 50-50 probability, and here's all the evidence that supports that, because you said there were studies out there that show this. Yeah. So that's where, and so those types of organizations are great, just like the mesothelioma, right? When it comes to certain conditions, they have the database of evidence and statements and everything to go along with those types of claims. So it's good to get their input on how to go about those claims. But it really just comes down to getting a doctor to say, yes, based on this evidence, it's at least as likely as not that this condition was caused by the veteran's service. Because that, at least as likely as not, what that does is it opens up, if you go to an appeal and it's a good opinion, well-rationed, and it's from a specialist. That's the key. Because when the VA sends you to a C&P exam, a lot of times it's a nurse practitioner or a doctor that may not be a specialist in that field. If you go to a specialist and you get that opinion, then you can turn around and submit that as part of the appeal, and the law judge will look at that and say, well, we're going to give a little more weight to this because this is a specialist. They're not a nurse practitioner. This is a specialist in this area, and they say it's at least as likely as not. If they give more weight to it, they'll grant it. Or if they give equal weight, then it opens up benefit of the doubt, and benefit of the doubt goes to the veteran. So getting opinions is really the best way to go about getting anything service connected. Going to get your own doctor's opinion. Now, there's companies out there, and the VA knows this because they tried to put the kibosh to it, is companies out there that you could pay money to and they'll write an opinion and you could submit it. The VA is aware of those. They tried to stop it by taking these public-facing disability benefit questionnaires off their site, but they were a lot of pushback against that, so they left those on the site, those disability benefit questionnaires. So the best thing to do is go to your own doctor, do the explaining. I actually have a couple sheets on Nexus letters so that you could take to the doctor and say, hey, here's the deal. Yeah.
Did the PACT Act help contribute to this deluge of emails we're getting saying, were you ever at Camp Lejeune?
So that's the different one. That's the Camp Lejeune Act. And really, I wake up in the middle of the night hollering, lawyer! Because that Camp Lejeune, you see it on every channel. So I'm not sure how the lawsuits work, because normally, due to the a tort act claim is going to offset your disability, right? So if you say kidney cancer, you served at Camp Lejeune, you have kidney cancer. You file for it, it's a presumptive. So that kidney cancer, now you're getting a benefit from the VA for, and then after the cancer's in remission, or if they have to remove a kidney, then you're going to get a certain percentage. Now you go and you file a claim with or a lawsuit with some lawyer. I'm not sure how that all works, but the Camp Lejeune Act itself is separate from the PACT Act, but it still deals with a lot of the exposures that were at Camp Lejeune, the contaminated water. So and that's another one that just because they only have certain things that are presumptive, if you do research and find what the chemicals that were in the contaminated water and what are some of the things they cause, and you might have one of those things, gather that information up, take it to the doctor and say, hey, is it at least as likely as not that this condition, was caused by this exposure while I was at Camp Lejeune, drinking that water.
So if you're getting a disability for that,
Mm-hmm.
and you file a claim with a lawyer, one of those stupid lawyers on the
Mm-hmm.
TV, and you win something, or it's a class action, I'm assuming, will that offset your disability?
Good question. I don't know for sure.
Seems to me it would.
It normally does, but I've had some people say they talked to the lawyer and they said it won't affect my benefits at all.
It's because the lawyer's looking for money.
Well, yeah, and that's really what's happening is they're getting in between what the veteran should get, because if that is the case, then someone that's been, say they give him, okay, we're going to give you $25,000. Well, the lawyer is going to get 40% of that.
Yeah.
But now they're going to offset what you've been getting by the full 25. You're paying that lawyer out of your pocket. So I'm not sure how that works, to be honest, but I know in the past, any type of claim that was, unless this is a separate fund somehow that they're putting aside and it doesn't affect your benefits, I don't know the answer to that. So I know a lawyer that does that would know the answer, but in my experience, any type of monetary benefit you're going to get is going to offset your VA benefits. I'm not sure that's the case with this, but it wouldn't surprise me if it were. Yeah, exactly. So, I mean, there's a lot of things changing, a lot of new things coming down. far as eligibility for the health care. A lot of it has to do with the toxic exposures and places people served. The other one is the PFAS chemicals and the AFFF. That's another one that, that a lot of bases have that stuff. So if you have a condition that's associated with that, through doing some research, then the thing I would do is go, take that to the doctor, whoever's treating you for that condition, and say, look, here's the evidence here. Is this at least as likely as not? Because they don't have to write a letter. They could put it in their notes that they feel that this is at least as likely as not, as long as the verbiage is right. At least as likely as not related to possible exposure to these chemicals while stationed at wherever.
And every sailor's gone through firefighting school.
Oh yeah. So just like in the Marine Corps, every Marine's a rifleman, every sailor's a fireman. So it's important to to have that discussion with the doctor. Sometimes they're not going to, if it's a VA doctor, chances are they're not going to write anything. Some of them will. Some of them do, because they really think that, yes, this is related. And some of them do from time to time. But if you have, and that's why I tell people, sometimes you got to go outside that VA system to get that opinion, because the VA is not going to write it. But it's important to have that discussion with the doctor if you feel that evidence shows that your condition that you're currently being treated for is related to a possible exposure of some sort when you were in. So it's a lot to take in, but that's where the onus of having it be your claim comes in, because it's whoever's filing the claim has to take ownership of that claim and say, hey, this is my claim. I'm going to have to do some legwork, right? I got to talk to my doctor. I got to maybe do a search, and look and see if the condition I have, what are some of the causes of it, and Google's a great tool for that. Google Scholar, you could find a lot of information on studies that have been done for certain chemicals and what types of ailments they cause. So, yep.
Most everything we've been talking about has been medical.
Mm-hmm.
Does the PACT Act or any other things broaden mental health support? So,
mental health, really, at any time, if you need mental health services, you can go to the VA. I know people have had bad experiences with the VA when they're trying to get mental health treatment. I always try to refer veterans, especially those that are just recently discharged, and if they have been in areas where they got hazard duty pay or combat, or have an award of some sort for combat, and I try to get them to go to the Boulder Vet Center, because the counselors there, some of them are combat veterans, and that makes a world of difference. Sometimes veterans, when they go to the VA, sometimes they don't feel like they're being heard. And sometimes it takes the VA a while to respond back when you're trying to get an appointment. But it doesn't really expand mental health services, because really, if anybody needs them, they can go to the VA. I don't know if they'll enroll you at that point in time into VA healthcare permanently, but they may, enroll for a period of time or do some assessments at least. So it doesn't really expand that I'm aware of. But I mean, and really anywhere you look for mental health treatment these days, there's a lot of organizations out there that will be, well, I wouldn't say veteran friendly, but they will see veterans, as part of possible, the grant money or certain grants that they get. There's a lot of organizations out there. I know that in Colorado, I think it was Mental Health Partners that had for a while here, some community outreach specialists for veterans. I think, I'm not sure if they did away with that program, but there's a lot. There's a couple schools too. I think DU might be one of them that does in Denver, that does a lot of family, counseling and stuff for veterans and different things. So I think there's plenty of places to get it. I think a lot of people, sometimes they go to the VA and they have bad experience and that's it. They don't want to go back, and the VA's come a long way in, past 20 years for sure, and longer than that. I mean, it's like night and day. They're doing a lot better job, but you're not always going to get. They still have some shortcomings. Some people have bad experiences, and some people are like this. Have no complaints. I've had the best care I've ever had through the VA. So I think where some of the problems arise is when veterans are having issues that the VA doesn't seem to want to pursue, right? So they might tell them, and I've heard veterans come back and tell me, they said, it's all in my head. I'm sorry, but this is not all in my head. I can't breathe. And it had one veteran that was fighting for the VA for years. Turned out he had a type of disease that he caught that almost mimics tuberculosis, but isn't tuberculosis. So all the stuff he was having, and they said, oh, well, here's an inhaler, you got asthma and all that, but it wasn't asthma at all. It was this, it was, yeah, and so this was a Mycobacterium canzaei is what this one was. Yeah, so it was and they kept saying it wasn't related to service. And it's like, well, let's see. He made the complaints while he was in service, trouble breathing, then he was getting discharged, and then that was that, and they went to the VA, and they were like, no, it's all in your head. He couldn't so he had to go alternative routes until they finally diagnosed it. And, and he's really quite upset about it because it disseminated in his body where he was getting these major issues that if they would have treated it early on, he wouldn't have had. Now he's having vision issues and all kinds of things that really, had they just sent him to a specialist and did a referral, probably could have avoided a lot of stuff. So I really do think that sometimes the level of care isn't where people expect it to be, and in this case, they probably should have did that referral. Yeah.
Well, maybe just to finish up, in fact, Doug, Dan, that's right. Dan brought up the idea of possibly when we do your next update, to focus it on the type of information that younger veterans who are recently discharged might find beneficial, and link up with some of the older ones who had to deal with some of that.
Well, and these recent ones getting out, I think they're automatically enrolling them now, or they're going to start automatically enrolling them in VA healthcare right when they're getting out, because they have non-combat veterans have a year, and then combat veterans get 5 years of VA healthcare. So they could at least start that process, and then of course if they're, depending on where they served and what type of exposures they have, then they could either stay with VA healthcare or not.
But that reinforcement needs to be, you need to go at least every 2 years.
Correct.
Whether you feel fine or not, to get a physical.
Yep.
Or something.
Yep.
And
I tell everybody just every 1 year.
I go yearly.
Yep.
The other thing, I've had wonderful experiences, with the VA. And one of the problems is the, as my wife says, the crusty old Vietnam veterans. I think it was because nobody listened to them, forever.
Yeah.
But if you treat those people over there with a little bit of respect, you're going to get it back, I think.
Yeah.
So
But it's because of those crusty old Vietnam veterans that the Gulf War veterans are being more taken care of than the Vietnam veterans were, because they're fighting for all that stuff, right? So, yeah. And then the other thing too is because of the Vietnam veterans, that's why they have the vet centers, because they weren't getting the mental health treatment they needed. So the vet centers are great because they're part of the VA, but they're not. The VA can't see those records unless you release them. So when you go to a vet center, you have to release those records to the VA before they could see them, which is important.
Well, thanks, Tim.
Yes.
Appreciate that.
Yes, thank you. Appreciate it. We'll schedule again when you want to come again, and I think that, yeah, if we could reach out to those, if you get the secret to reaching out to those younger veterans, let me know, because I've been trying. So, thank you. Appreciate it.